problems coming out of Washington, D.C. And if you look at the inflation that people are suffering under, this is the worst inflation we've seen in 40 years in this country. It was something that did not have to happen. This was something that in many ways was self-inflicted with excessive printing of money and borrowing and spending gratuitously, I would say, that was not necessary. Also, it's a reflection of a policy instituted as soon as Joe Biden took office, which is really an anti-American energy policy to try to kneecap energy production in the United States, thinking that somehow that would cause people to have to use windmills and all this other stuff. You know, that's just not the way the world works. And so all that's doing is imposing a lot of pain on the American people. It's impacting businesses across the board. You know, you see it at the gas pump, which is really significant. But yet you talk to small businesses seeing their costs just explode across the board. A lot of that is tied to energy. Some of it's tied to the supply chain problems that Biden has not alleviated. And so we see those issues. It's a huge, huge crunch. I think the economy, we'll get the numbers on the second quarter, but you know, when you have 2 consecutive negative quarters, that's technically a recession. So we may already have hit that, but I think clearly there's storms on the horizon. So we've protected ourselves in Florida. You know, we're going to be able to handle whatever exigencies there are in terms of our budget. And we'll make sure we continue to meet the obligations. You know, we've done a lot for conservation and the environment and the water quality. We've done a lot for in education. We're going to do even more for that. Law enforcement, making sure that we remain a law and order state and that people know that we're going to put people behind bars who violate the law, not like these other states where they release all the criminals on the streets, and you see how destructive that's been. So we're going to do all that. We're built for the long haul. But I think one of the things that we've wanted to do is say, okay, you see the inflation. You know, what can we do to make an impact? July 1st just started a lot of the tax holidays for people, which is something that we think will help make a difference. Biggest tax package we've ever done in the history of Florida is $1.2 billion worth of tax relief. Where else can we make a difference? And one of the areas that we've been focused on really since I became governor in terms of high prices that are biting Floridians is in terms of prescription drug costs. And so when I became governor, we wanted to look to see what can we do as a state level, even though most of this is driven by Washington, what could we do to potentially make an impact on prescription drug prices for Florida? And so we really did a deep dive to see what our options were. I worked with the Speaker of the House at the time, Jose Oliva, who was really aggressive in wanting healthcare price transparency, telehealth, all these different things to try to make healthcare a little bit more affordable and bring some sanity to the process, because it's a very convoluted process that's not in the best interest of the average patient. And so what we were able to identify was a provision of federal law back in 2003 that was enacted that no one had ever done anything, that said that you can petition HHS to be able to purchase drugs from Canada. Now, these are the same drugs they sell in the United States. They're just a lot cheaper because they have different policies. And in the U.S., we pay basically for the rest of the world to have cheaper drugs. And so that's part of the thing, because the pharmaceutical industry is very powerful. There's a lot of different reasons for that. So we said, okay, if this is an option, I can save hundreds of millions of dollars in Florida by doing it. So I went up to Washington. I met with President Trump. We briefed. Some in his administration didn't want us to be able to do it, but he said that we should be able to do it. So he approved us. We went and did a package in the legislature, passed a bill, submitted a proposal, and this is not an easy thing to do. We did it. The Trump administration got it towards the end of the term. So then Biden came in, and we didn't know what was going to happen. He actually signed an executive order last year saying he wanted to do give access for Canadian drugs, but they have stalled it. They've not done anything to approve our request. And again, this would save hundreds of millions of dollars for the state of Florida. And so we're still fighting that. We just did a FOIA request to get the information about why they're stalling the decision. Now, maybe they just don't want to give Florida a win, and that wouldn't be surprising knowing what they're doing. It may be that pharma has told them they don't want this, but, you know, we've got to stop doing policy just on the basis of what pharma wants. I mean, we've got to do policy on the basis of what the people think is the best. So that's been a focus. We're still in that fight. We may even end up in litigation over this potentially, but we were happy to lead the way. Other states like Colorado and others have also wanted to do this as well. We actually have a place. There's a company's got a place in Polk County, massive warehouse ready to go. I toured it last year and we looked at it. It's really impressive facility. You know, you'd buy the drugs, apply the appropriate labels. And here's the thing: these are the same drugs. I mean, that's the thing. It'd be one thing if they were different and there were safety, but there's no safety. It's the exact same thing. So we're working on that. But the other thing we said is, okay, where else can we make an impact? And what we've seen over the last probably year or so is you've seen some states reach settlement agreements with some of these insurance companies based on the performance of these pharmacy benefit managers and how the prescription drug benefits were administered. And basically, this is an admission from insurance companies that the states and the taxpayers were being overcharged. And so I asked Simone Marsteller, our Secretary for Healthcare, Agency for Healthcare Administration, to do a deep dive into the role of PBMs. And it turns out the state of Florida, and all of our history, had never really done an investigation into the role that PBMs are playing in increasing the cost of prescription drugs for Floridians, and particularly for senior citizens. And so they've looked, and this is an incredibly opaque process. This is, and you can see why there's money potentially being skimmed, because it's very much out of view, and this has really developed into a cottage industry. And so she looked at it. We've been doing a lot of investigation, and that brings us here today, where I'll be signing an executive order to ensure that we have reforms in place in the state of Florida to hold pharmacy benefit managers accountable and to drive transparency in prescription drug costs. And so these are, yeah. So these are entities that are contracted to manage prescription drug benefits for insurance companies. They're effectively middlemen in the process. And you remember when President Trump was in office, he would talk about middlemen. This is part of what he was talking about. And so we want to be able to reduce the amount of basically arbitrage where people are making money, but it's not serving any broader purpose. And so that's the import of these reforms that we're doing. We are directing our state agencies to look at all their contracts with PBMs and ensure that all costs to the state of Florida are justified. And so they're going to be the ACA and the Department of Management Service will audit the PBMs that have performed services for them in the past to determine if cost-saving measures are in place, and if not, we're going to insist that they will. Agencies are also directed to enact provisions to prohibit what's called spread pricing and clawbacks in contracts with PBM. Now, spread pricing is a deceptive practice where PBMs collect payment from the individual and keep leftover funds after they've already reimbursed the pharmacy for the prescription and the service costs. The practice essentially adds in a middleman, and that practice drives up the cost for everyday Floridians. Clawbacks occur when an individual overpays for their prescriptions, and the PBMs keep the overpayment as a financial bonus. So the collection of overpayments for fraud, of course, will still happen, but we want to make sure that we're getting eyes on all of these other ways of them making money. Agencies must also enact transparency and reporting requirements, including a review of all rebates, payments, and relationships between pharmacies, insurers, and manufacturers. So this will also help to lower the cost for Floridians and will make the cost of prescription drugs more transparent. So we are proud to have been the leader on the Canadian drug proposal. We hopefully we'll get some positive on that. Honestly, this should have happened like a year ago, and we still don't have an answer on it. Other states are in the queue. But in the meantime, this executive order is really probably the first time Florida, as a state, has taken action to ensure that we're saving money for Floridians regarding the middlemen and what happens with the prescription drug programs. And so I think it's going to be very, very meaningful. Now, we have a number of our legislators here with us today who I'd like to recognize. We have the next president of the Florida Senate from Southwest Florida, Kathleen Pasadomo. We have Senator Ray Rodriguez, and then we have Representatives Botana, Persons Malika, and Gio Lombardo from the Florida House here. And so this is step one. It may very well be that we are going to be doing legislative reforms in the next legislative session as well. And again, all in an effort to make sure that the things that really matter to people are affordable. And we don't have carte blanche in the state of Florida when it comes to these major international markets like prescription drugs. But if we can take concrete action to make a difference, you bet we're going to do that. And that's what we're doing here today. We will get an answer with this FISA, the FOIA. We submitted the FOIA request to the FDA about, hey, give us some information about what's going into making this determination about our drug program, and we want transparency into the process. We want to know what they're looking at, and they have 20 business days to respond to our request. And so we will be watching very closely to ensure that they comply. And look, I mean, hopefully it doesn't come that, but you could end up seeing litigation as a result of that. So this is significant. Now you look at cost of food, cost of gas. Prescription drugs is a problem, but it's not new in the last 2 years. I mean, the prescription drug's been an issue for this country for a long time, and we're proud to have spent a lot of our capital and time on trying to bring some relief to Floridians. And so today will be an important day, and I want to thank everyone who was involved with helping us get to this point, Simone and her staff, as well as the people in our office. And so with that, I'm going to let Simone come up and say a few words.
Thank you.